This is an extract from the DECEIT Syndrome. In his professional lifetime, Rob had witnessed doctors who fancied themselves as amateur political movers and shakers, and they certainly were amateur, being outmanoeuvred at every step by the professionals. Some well-meaning maybe, but most just got turned on by mixing with those with influence and with the well-known, and by walking the corridors of power. To be able to boast to friends and family about that meeting with the minister, but a walk down the corridor of power was as far as it went. They achieved and influenced little, as they were wrong-footed on their walk all the way, never seeing the bigger picture, just dealing with what to them seemed like individual, relatively insignificant decisions, one by one, and never looking up to notice where they were being led. Outmanoeuvred at every turn, led by the nose to downgrade their profession, castrate it, and to cooperate in the destruction of the NHS, salami slicing. Some were naive do-gooders, some cooperating Quislings. Then the other group, the troops, the group that he and Clive belonged to, just going along with it, moaning yes, but not prepared to put up a fight. They all claimed to be too busy with the day job. Being at the coalface did not allow them the time to mess around in talking shops or spending days in meetings. They could not or would not see that the coal mine was collapsing on top of them. They did feel they were being buried alive, but by the workload. They did not connect the politics with their working lives. So in less than 30 years, the medical world had travelled from a highly regarded profession to just a bunch of workers, highly trained experts to dispensable technicians. Consultants who were now two a penny and knew everything about one small part of the body and nothing about the rest. Goodbye the holistic approach to the whole patient. GPs were no longer family doctors with continuity of care throughout their patients' individual lives, often caring for 4 generations, but had been turned into strangers to all who walked through the door. With no continuity or familiarity, there was no trust. With no trust, complaints escalated, egged on by the media and the government, who were only too pleased to see rivals for the public's affection kicked when they were down, tripped over by them, but tripping over their own feet too. It was so obvious to Rob now that the two main requests of the insurance industry before it took over the healthcare of the nation were the need for less care and cheaper downgraded staff. This would allow the companies to maximise their profits, their top priority and their duty to the shareholders, which was way above the quality of safety. It was all on the Nixon tapes.